us how many critical care hospital beds we currently have, and I know that will change with shifting around, and how many you think we will need in the fall?
I'll have to pull that number, but what I'll say is, we're running around 500 hospitalized patients every day with coronavirus for the whole state, and although that's not the largest proportion, that's not ICU total patients. We're running usually around 100 ICU patients, but that's taken up about maybe 10 to 15% of our capacity across the state.
The ICU cases?
Yeah. And so, but we're full in so many places, and so we have a stressed health infrastructure, and then we're adding stress on top of stressed infrastructure, and we don't have the staff to take care of the people that we have right now, essentially. So, and now is the slow time, which I know it sounds kind of preposterous, although it's becoming less slow as the cases begin to mount. It's going to be a real, major stress on the health system, and it could be a healthcare disaster going into the fall.
When you say we don't have the staff to take care of the patients now, is that ICU patients or just generally COVID patients in hospitals?
Yeah, what I'm hearing though is mostly the ICU care is overrun. Just don't have the physicians and the specialty nurses and the respiratory therapists who are available to take care of that complex sick population.
And is this just in certain areas of the state? Are we seeing that on the coast, or what areas of the state are we seeing this crowding and having to transfer patients?
It's everywhere. Certain parts of the state have more coronavirus contributing to the problem. Probably the central part of Mississippi is a little bit more, Jackson, Vicksburg going east, Meridian, Laurel, Hattiesburg. They seem to be pretty stressed out as far as some of the Delta locations. The coast is stressed, and they have limited bed capacity. It hasn't been so much coronavirus; it's just been other stuff going on. Perhaps a backlog of illness that people are coming back into the system. But when we look at the reports, we see pretty frequently that there aren't ICU beds available in hospitals on the coast. And all you got to do is add a few more coronavirus patients on there, and then you have people who, when they get sick and they go to the ER, they have nowhere to go.
So, do you think we need mask mandated, and under what circumstances?
So, there are some social distancing guidelines, I know, for retail that also need to be followed. We need to all be wearing masks when we're out in public. And I think that, mandatory masks for businesses is something that certainly makes sense. We are in a challenged environment where, unfortunately, there's been this sort of bizarre resistance to wearing masks that's really not based in any science, that we're having to sort of educate around. So yes, I think everybody needs to wear them. I would be pretty happy for every business that interfaces with the public to wear masks. In our own public health departments, we mandate masks. If you're interfacing with the public, you wear a mask. If you're in a meeting and you can't social distance, we mandate masks. So it's something that we practice what we preach, and we believe in it.
Why would you advocate or not advocate going back to some quarantine measures, as I believe some other states are starting to do now?
The problem that we're seeing is not that our pathway has been too aggressive. It's that people aren't following the rules. And I know that when we all go around, and if we go to a restaurant, sometimes we'll see that people are packed in, not wearing masks, or certainly staff is supposed to wear masks. We see, the gatherings, the social gatherings is one of our biggest problems. According to the executive order, you can't have a social gathering more than 20 people indoors if you can't social distance, and we're seeing that all over the place. It's 50 people outdoors, and we're seeing that all over the place. So those are the things that are killing us. Certainly if something more aggressive were to happen, it might help, but people aren't following the simple things now. And the simple things would make a difference if people would just pay attention and embrace those easy things. The 6 feet of mask in small groups we would be just having a different conversation.
Will you or other health department officials be meeting with, I saw somewhere where you said you're really going to be relying on local leadership to set an example, and not just political leaders, but churches and business leaders. Does the coast have any, does the health department have any plans to meet with leaders on the coast? We've got two counties, Harrison and Jackson, where cases are going up fairly significantly. And then Greene County looks like it's currently George County looks like it's currently a hot spot. Are you all meeting with any leaders down here, and what do you expect from them? Or what would you hope for from them?
We don't have any meetings scheduled, although we've worked with, local mayors and health systems and other people along the way, especially early on, and also the legislators from the area. Our expectation, or what our hope is for those who are in positions of authority to lead in a safe way such that their communities can be safe. And there's a lot of pieces of that. Part of it is actually embracing the orders that exist that have some flexibility so people can live their lives and businesses can operate, but making sure that those things that can be done to protect people are done. Also to embrace the scientifically backed measures such as the mask and the social distancing, so act as an example. And then where possible, like if, for your own, city hall or your own church or your own business, take the responsibility, own it, protect your employees, protect your patrons, such that we don't have more outbreaks going on. We have to have a critical mass of support to have any of these things be successful. And when we have had meetings with different counties, and we've included health systems and board supervisors and mayors and city council people and other people who are critical to the community, including law enforcement and first responders, when they all come together with a cohesive sort of support for these simple measures that are going to save people's lives, it makes all the difference in the world, because the communities will then better understand the reality of what we're looking at, understand the risks we're facing, and then better embrace those simple things that we just got to do.
Contact tracing and testing were cornerstones of your strategy. Where are we with testing? And on contact tracing, do you honestly believe we have enough contact tracers to be effective? I know the health department told me 15 were working in all of South Mississippi counties.
Yes, on the testing piece, we've continued to test at a pretty good clip. We're keeping up at our goal of more than 2, ideally more than 3% of population per month. And so we're doing well with that. And even so, we're probably doing much better than that as more point of care testing or, get tested locally is done. And we've been unable to track all of those negative results. So the testing piece, I think, is okay. And we want to make sure that we have capacity, and we have additional capacity when we need to ramp up. So, that seems to be going reasonably well. On the contact tracing, I will say that we do need to hire more folks, or we're in the process. We're hiring nurses, we're hiring disease intervention specialists, and we're also looking at hiring a whole team of people for so there's 2 parts of the case investigation, right, where you talk to the person who's sick and put them on isolation and help them out, and then you have the contact piece. And so we're going to look at bringing on a whole lot of additional staff for the contact tracing. We have been able to keep up pretty well until a couple of weeks ago, but with the increasing case burden, and then also to the returning responsibilities for our other nurses that have to do other things like tuberculosis or immunization, we are seeing strains on the system. We've been trying to get folks hired up for a while. It is a little bit of a laborious process, especially if you're in a state agency and have all these sort of cumbersome processes you have to follow. But yes, we need more. We're working to get more. We want to add, a couple hundred more.
What are your concerns about colleges reopening and schools starting back in the fall?
Our main concern is that we feel comfortable that there's safe ways to educate kids, but extracurricular activities and social events that occur outside of the sort of education forum are going to be high risk, and trying to manage that risk is going to be extremely difficult and perhaps even impossible.